Okay, now I'm going to talk about the muscles of the wrist, and the muscles of the wrist are primarily the carpes. So you have flexor carpi radialis, you have flexor carpi ulnaris. I'm also going to talk about the digitorums, flexor digitorum superficialis, flexor digitorum profundus, and then you have the extensors. So you have the carpes, the extensor carpi radialis longus and brevis, the extensor carpi ulnaris, and then the extensor digitorum. So note that in the wrist, things are kind of named for what they do. If it's got a word flexor in the title, it's going to flex the wrist. If it's got the word extensor in the title, it's going to extend. If it's got the word radius in the title, it's going to move the hand or the wrist towards the radius. If it's got the word ulnar in the title or ulnaris, it's going to move it towards the ulna. If it's got the word digitorum in the name, it's going to move the digits. So it's pretty straightforward. In terms of nerve innervation, everything on the posterior side is radial, and that's true from up here to the shoulder all the way down. It's all radial. And then on the anterior side, most of this is median. Okay, most of the forearm is median. There's some things on the ulnar side, like especially the fifth finger, are going to be ulnar nerve, and some of the deep muscles of the hand are ulnar nerve. But most of the forearm, almost all of the thumb, is all median. Okay, so starting with the extensors, you have the extensor digitorum, extensor radialis longus and brevis, and that's going to come from the lateral epicondyle, the common extensor tendon of the lateral epicondyle, and that's going to be, extensor radialis brevis and longus come from the lateral supracondylar ridge. Sorry about that. Lateral supracondylar ridge, and then they insert into the longus goes to the base of the second metacarpal, and the brevis goes to the base of the third metacarpal. They're both going to extend the wrist and then radially deviate. The extensor carpi ulnaris is going to come from the common extensor tendon off the lateral epicondyle of the humerus, and it's going to insert into the base of the fifth metacarpal, and it's going to extend the wrist and ulnarly deviate. The extensor digitorum muscle is going to come from the common extensor tendon off the lateral epicondyle of the humerus, and that's going to insert into the distal phalanges on the distal on the dorsal side. It's going to extend the PIPs and the DIPs. On the flexor side, you have flexor carpi radialis, and that's going to come off of the common flexor tendon off the medial epicondyle of the humerus, and it's going to insert into the base of the second and the third metacarpal, and it's going to flex the wrist and radially deviate, and the nerve is median. And then you have flexor carpi ulnaris that has a humeral head and a ulnar head. The humeral head comes off of the common flexor tendon off the medial epicondyle. The ulnar head comes off of the shaft of the ulna, the proximal kind of posterior half, and it's going to insert onto the pisiform, and it's going to ulnarly deviate and flex the wrist, and its nerve is ulnar. Okay, so the flexor carpi ulnaris is the ulnar nerve. And then you have the two digitorum muscles. Flexor digitorum superficialis comes from the common flexor tendon off the medial epicondyle of the humerus, the coronoid process of the ulna, shaft of the radius, and the ulnar collateral ligament, and it's going to insert onto the sides of the third, up to like the third phalange, or the middle phalange, and its primary responsibility is to flex the PIPs, and then you have the flexor digitorum profundus that's going to come from the proximal 3/4 surface of the ulna, and it's going to come to the distal phalanges, and its primarily responsibility is to flex the DIPs. The flexor digitorum superficialis is median. The profundus, the two tendons on this side are median, and the two tendons on this side are ulnar. And those are some of the muscles of the wrist and the hand.